Daniel.
Hi, how are you?
My name's Antonella. I'll be the nurse taking care of you today. Can you tell me a little bit about why you're here? As the patient gives a brief health history, it is important to examine their general appearance. This patient appears their stated age. He is awake, alert, and oriented to time, person, and place. His skin color is normal. He appears to be of appropriate nutritional status. His posture and position is comfortably erect. He has no obvious deformities. He is mobile and his gait is normal. His facial expression is appropriate to the situation. The speech is normal and he does not appear to have trouble hearing.
For the last couple of days I've been having a little bit of trouble sleeping. And I think it's because of my sinuses. I've been having a lot of pressure and a lot of pains. And that's why I came in to get looked at.
Okay, and how long have you had this problem?
I've had it for the last 3 to 4 days.
3 to 4 days?
Yeah.
All right, what we're going to do is start off with a head-to-toe assessment, and we'll go ahead and target your problem areas after.
Okay, sounds good.
Let's take a look at your chart. Your height and weight put you at a BMI of 23.4, which is within normal limits. Your hemoglobin is good, your hematocrit is good. All your labs are normal as well. Before we start our head-to-toe assessment, why don't you go over to the bathroom so you can empty out your bladder.
Okay.
Okay, let's start with your vital signs. As different regions of the body are examined, the skin in those regions should be examined as well. (115/60). That's great. Let's do your pulse now. As the radial pulse is taken, respiration should be counted so the patient does not change their breathing pattern. (59).
Great.
Now, let me go ahead and start the head to toe. Inspect the head by palpating the scalp, hair, and cranium. Palpate the temporal artery, followed by the mandibular joint. Close your mouth, please. Does that hurt?
No.
Do you feel any pressure? Palpate the maxillary sinuses and the frontal sinuses.
Yes.
Okay. Assess cranial nerve 7 by inspecting facial expression and symmetry. Very good. So far, everything looks great. Let's take a look at your eyes now. To test the pupillary light reflex, advance the light from the side and note the response. There should be a constriction of the same-sided pupil and simultaneous constriction of the other pupil. Great. Can you follow my pen light, please? Leading the eyes through the 6 cardinal points of gaze will elicit any muscle weakness during movement. We're just going to take a look inside. The lower lid should be pink and white over the sclera. I'm going to take a look at your ears now. Inspect the external ear. Look at the position and alignment, skin condition, and auditory meatus. Move the auricle and push the tragus for tenderness. Does that hurt?
No.
Great. Now, can you open your mouth for me? Inspect the buccal mucosa, teeth and gums, tongue, floor of the mouth, palate, and uvula. Great. Open your neck here. Does that
Palpate
hurt? The neck and check for symmetry, lumps, and pulsations. Palpate the cervical lymph nodes. Palpate the trachea and make sure that it is midline. Okay, now I want you to face me. Try to push up against my hands. With your shoulders, shrug. Good. Can I see your hands? Your skin looks intact. And you have a capillary refill of less than 3 seconds, which is good. All right, now squeeze my fingers. Put your hands like this. Push up. Push down. Great, everything looks good so far. Okay, now we're going to do a brief examination of your chest and your back. So I'm going to ask that you take your shirt off, please. Inspect the posterior chest. Look at the configuration of the thoracic cage, skin characteristics, and symmetry of shoulders and muscles.
Good.
Palpate for symmetric
Now
expansion.
we're going to auscultate your lungs. You're going to feel a little bit cold. Can you take a deep breath?
Auscultate breath sounds, comparing side to side in upper and lower lung fields. Inspect the respirations and skin characteristics. Palpate for tactile fremitus, lumps, or tenderness.
Take a deep breath.
Auscultate breath sounds, again, comparing side to side in upper and lateral lung fields.
Can you lean forward, please?
The patient lean forward and auscultate the cardiac base for any murmurs.
Let's listen to your heart sounds.
Inspect the precordium for any pulsations or heave. Auscultate the apical rate and rhythm. Auscultate with the diaphragm of the stethoscope to study heart sounds, inching from the apex up to the base or vice versa. Auscultate the heart sounds with the bell of the stethoscope, again, inching through all locations.
We're going to take a look at your abdomen now.
Inspect for contour, symmetry, and skin characteristics first. Then, auscultate bowel sounds.
When was the last time you had a bowel movement?
This morning.
Just going to feel a little bit here. Let me know if you feel any pain or tenderness.
Palpate for any obvious deformities.
Okay, very good. I'm going to look at your legs now. I'm just going to feel here for your pulse.
Inspect the lower extremities for symmetry, skin characteristics, and hair distribution. Palpate the pulses, palpatile, posterior tibial, and dorsalis pedis. Palpitate for temperature and pretibial edema. Separate the toes and inspect.
Take your socks off for a minute. Sorry about that. Can you wiggle your toes for me? Good. I'm going to lift your leg for you.
Test range of motion and muscle strength
Very
of
good.
hips, knees,
Can you push
ankles, and feet.
Now push down. Do the same thing on this side. Oh. Okay. Push up. Push down. All right then, Mr. Grania, it was very nice meeting you, and I really hope that the prescription the doctor gave you is going to help you with your sinus problems.
Okay, thank you very much.
If you have any problems, give us a call back.
Okay, thank you.
Thank you.